Rochelle Schultz, CEO of Winona Health. And today I wanted to provide an update to the community about where we are relative to some of the recent changes as far as the COVID-19 situation goes in our community. So about 2 weeks ago, we started looking at being able to open our clinics again to full-time hours. As you know, they were at a part-time status. And so we have done that. Patients are coming back, and we welcome patients to come in for care. What I do want you to know is some of the changes that you can expect when you come here. So given our current environment, we are not past the COVID environment. It is not over. I think this is going to be with us for some period of time. So what we wanted to do is to ensure that we are protecting patients who come in to our buildings, as well as all of the staff, the healthcare workers who are here to take care of you. In that regard, what we have done is put in some screening processes. Some of these have been in place already, and some of you may have experienced that when you've walked in the door, where we have a staff member greet you and ask you if you've had symptoms, provide you a mask, and that type of a thing. This is actually going to be elevated even a little bit more, and this comes from some direction through the Minnesota Department of Health, as well as the Centers for Medicare and Medicaid. And what we're going to be starting this week actually is temperature taking. So in the past, we've had some areas where we've actually been temping we have some other areas where we've had staff self-temp just to look for signs and symptoms. The requirement, however, is that we do what is called active screening. This means that somebody will take your temperature. Now we have those thermometer scanners, so nothing actually touches you as far as that goes. It's a little scanner that's held to, close to your forehead to take your temperature. You will continue to be asked the screening questions about signs and symptoms, and we will also provide you a mask unless you bring one with you from home. Again, we want to have an environment that is going to be protective for our patients who are here, as well as our staff. So we know that this could potentially cause a few bottlenecks. We've been working through what some of those kind of timing issues might be, and doing our best to accommodate and make sure that the service that you get is really great. So we do ask that you bear with us a little bit as we get these processes in place. We understand that they don't feel convenient and they can be a little cumbersome sometimes, but this is for the safety of everybody. The second area that we are expanding back into our regular services is with elective surgery. So we have already this week been standing up some of the backlog, if you will, of surgeries that have been out there. And so over time, obviously we're not going to pick all of that back up in a week or two or something like that, but we are incorporating the backlog that we've had and patients who've been waiting into the current schedules. Now again, both with our clinics and with surgery, we're being very methodical and very thoughtful about how we do this. We want to make sure that we are in the whole environment is still going to be supportive, that the environment is going to be safe and protective. This is our infection prevention types of activity that we're doing. And so again, even with surgery, if you're scheduled for surgery, one of the things that you can expect there is that we're going to be doing some testing. We're actually going to do some COVID testing on patients to ensure prior to surgery that they are not, they don't carry that infection. This again is for the benefit of the patient, but also for the healthcare workers. This particular virus, as you know, is one that it gets carried in the air through droplets. It's aerosolizing is the term that's often used. And in surgery, this can be a real issue relative to things like intubation for our anesthesia workers and that type of thing. So doing this testing ahead of time is just another elevated safety factor for all of the parties that are involved. So we do have some new processes in place. I think as we look at what's the go forward in our new environment here, understanding that COVID is not going away in the foreseeable future, we have no idea when there will be a vaccine, if there will be a vaccine, all of those kinds of things. So we've just needed to really incorporate the reality of having COVID, out in the environment, within how we operate as a healthcare institution. So your safety is a top priority, our staff safety is a top priority, and many of these changes that we're putting in place is to protect everybody who is involved. So want to thank you all for your patience with this, your understanding, and certainly, we thank you for choosing Winona Health. Thank you.